What is carpal tunnel syndrome? It is basically an irritation or compression of your median nerve. Your median nerve starts in your neck, travels through your shoulder, down your arm, into your forearm, through your wrist, and to your middle three fingers. It is a compression at the wrist and into the fingers. So, what are the common symptoms of carpal tunnel syndrome? Burning, numbness, tingling, pins and needles, or weakness. You would typically find the pain from carpal tunnel is at the wrist and in the hand. So, if you're suffering any of those symptoms, could be carpal tunnel syndrome, could be something else as well. But if it is carpal tunnel syndrome, common causes, repetitive actions. So, using a hammer, screwdriver, grasping objects, lifting, really common causes. Otherwise, if it's not a repetitive type action, it might be direct trauma to your wrist, perhaps a fracture or an injury to your wrist, as well as very common in pregnancy. In pregnancy, your extremities become swollen. You get a lot of extra fluid, which can compress those external nerves or the nerves, extremity nerves. So that is also a common cause. Treatment options. How do we treat carpal tunnel syndrome? Well, carpal tunnel syndrome, we can do soft tissue therapy to your wrist and forearm. We can do ultrasound therapy to reduce swelling and inflammation. We can do median nerve stretches to try to improve that movement of that median nerve and therefore reduce restriction on it. If those sorts of treatments don't work, we will refer you off to someone who's better suited to perhaps discuss about decompression surgery. So that would be surgery to reduce tension on that median nerve as it passes through the wrist and therefore reducing your symptoms. So that is carpal tunnel syndrome.